Hello guys. Welcome to my channel. Today we are going to cover type 2 diabetes mellitus as much as possible. Remember, you can watch my previous videos about diabetes to get basic knowledge. Now we will see some common points about type 2 diabetes mellitus. It is a most common type of diabetes. It can develop gradually without any symptoms. It's often detected by routine investigations. In type 2 diabetes, we can see combination of insulin resistance and beta cell dysfunction. Diabetic ketoacidosis is less common. The acute complication of type 2 diabetes is hyperglycemic hyperosmolar state.
You can see this picture. In type 2 diabetes, at start the production of insulin is not affected significantly, so insulin is still there around the receptors, but receptors are not ready to bind with insulin. It's called insulin resistance, the major problem in DM2 patients.
Another important thing is etiology of this disease. There are 3 etiological factors predispose type 2 diabetes. First, genetic susceptibility and inheritance. Second is environmental factor. Third is inflammatory factors. All above factors influence in developing of this disease. When we go through genetic susceptibility and inheritance, the identical twins of patients with type 2 diabetes have more than 50% chance of developing diabetes mellitus, and the risk of non-identical twins have more than 25% chance of developing type 2 diabetes. But remember, strong genetically predisposed diabetes is type 1. Next one is environmental factor. Dietary habits are determine the development of the type 2 diabetes, because it can control the occurrence of the obesity. Obesity is a major causative factor for type 2 diabetes. Low birth weight also cause obesity in adults. Furthermore, smoking and alcoholism can predispose this disease. Final one is inflammatory factor. Subclinical inflammatory changes are characteristic of both type 2 diabetes and obesity. C-reactive protein, fibrinogen and plasminogen activator inhibitor are increased in diabetes. They can lead to cardiovascular risk. Cytokines, tumor necrotic factors also increased in this disease. The inflammatory factors can favor the pathogenesis of diabetes. The diagram shows the summarized form of causes of diabetes. Let's have a look. Main metabolic changes in type 2 diabetes are hyperglycemia and dyslipidemia. So routine glucose and lipid profile testing is essential for management of diabetes mellitus. This picture shows the difference between type 1 and type 2 diabetes. You should have a clear idea about these two types for diagnostic purpose. Finally we comes to the end. It's enough today. I think you can get some idea about type 2 diabetes. Don't forget to subscribe my channel. Thank you.